Hi, hello to all. So I'm Dr. Alia binti Muhammad from Leiya Wellness. So you can call me Dr. Alia. So today's topic I'll be presenting about vitamin C deficiency. Okay. So what is the subtopic that I'll be covering? So I highlight here. It will be a brief introduction and definition on vitamin C deficiency, as well as why do we have vitamin C deficiency, who might have it, how does vitamin C works, what are the symptoms, where will be the vitamin C source, what to do with vitamin C deficiency, and some extras sharing on vitamin C deficiency, as well as the last will be conclusion. Okay, so without further delay, I'll start my presentation. So here is the recommended daily dietary allowance value of vitamin C. It will be 90 milligram daily to prevent deficiency. So if we have our intake is less than 10 milligram per day for more than 1 month, so we might be having subclinical scurvy. Okay, so what is scurvy? Alright, scurvy is actually a disease, a potentially deadly disease. Before the 17,000 centuries ago, this is a potentially deadly disease, killed as many as 2 million sailors, causing a huge problem for them back then. Due to the diet lack of vitamin C, they bleed to death. So this scurvy disease actually caused bleeding. So they bleed to death at that time. Okay, so what Later on, we knew that the problem was actually easily corrected with diet having adequate amount of vitamin C, because their life is mostly onshore at the sea, right? So the diet is more on seafoods, fishes, so they are lacking of vitamin C food source, so they develop this scurvy. Nowadays, scurvy is not actually easily found because a lot of modern food are actually fortified with vitamins, including vitamin C. So we don't find scurvy nowadays, but we do find subclinical scurvy, all right? Now I go to why do we have vitamin C deficiency? Okay, there are two reasons why do we have vitamin C deficiency. The obvious reason, one is because human body does not actually make its own vitamin C. We are different from animals. Animals, they do produce their own vitamin C, so they won't develop heart problem because of this vitamin C they can produce. But us human, we don't produce vitamin C, okay? And number two is because vitamin C is a water-soluble type of molecule which dissolve in water. So our cells are constitute mainly water. So when we consume vitamin C, it won't get retained inside our body. It will get dissolved out. So it will be excreted out through urine. So we will be having vitamin C deficiency because of this reason also. Okay. Now I go towards who are the group prone to have vitamin C deficiency. Alright, one, if the people are taking a poor dietary intake, so the food source are poor in vitamin C, so we will be having vitamin C deficiency. Another thing is eating high sugar diet. So in my next slide, I'll explain further why high sugar diet we will have vitamin C deficiency. Right, next will be drinkers and smokers. Okay, if drinkers, in alcohol actually we do have high sugar content as well. So if we have high sugar, we will be having vitamin C deficiency also. I'll be explaining in my next slide. So for smokers, inside cigarette content, we have a lot of toxins, meaning chemical toxins, metal toxins. So when we have a lot of toxins, there are a lot of free radicals inside our body. So that causes our body to need to fight that damage further. So we will have problem with vitamin Z deficiency because vitamin C works to fight those free radicals. So that part also I will explain further in my next slide. Okay, then who else are prone to have vitamin C deficiency? A person with frequent infections. So, person with frequent infection, we know that if we have infection, we need to take vitamin C. But actually, the person who are having frequent infection also, they do have vitamin C deficiency. So, I will explain this further also in my next slide. Okay, state of infection requiring high level of vitamin C. Okay, number 5. Pre-diabetes, okay, pre-diabetes, diabetes and insulin resistant. So a lot of people know about this, about diabetes. So diabetes patient, we do have high level of sugar in our blood. Okay, even pre-diabetes, high level of sugar inside our blood. But what is insulin resistant? Insulin resistant, usually if we take blood, we don't see that our blood sugar is high. But we do have high level of sugar, which cannot be seen yet. But if we take certain type of tests, we do notice that we have insulin resistant. How do we know that we have insulin resistant? If we have tummy, you know, like Malay people, they call it buncit. So if we have tummy, that means we are in a state of insulin resistant. Okay? Alright, so for diabetes or pre-diabetes and insulin resistant, why does we have vitamin C deficiency? Because the disease actually depletes body's vitamin C reserve due to tackling inflammation caused by free radicals. High sugar level inside our blood is actually toxic to our body. So we don't want high sugar inside our blood. So if you have high sugar level inside our blood, it will cause inflammation. So that inflammation needs to be tackled by vitamin C. So that's why we will be the deficit with vitamin C, because we have a lot of free radicals. Okay. Okay. Next, another reason why diabetes causes vitamin C deficiency is because, because sugar actually fights for the same spot as vitamin C. The sugar molecule is actually the same as vitamin C, so our body tends to choose sugar. Okay, our survival instinct, the survival mechanism of our body, we want that sugar for us to fight, for us to run away from danger. So our instinct, our body mechanism, for the survival instinct is to take sugar first. So if we have high level of sugar inside our body, we won't be using the vitamin C. So because of the vitamin C is water soluble, it'll be excreted out. Okay, so because of high level of sugar, people with diabetes will have vitamin C deficiency. Okay. Okay, next, the group of people who have vitamin C deficiency will be the one with digestive problem. So digestive problems such as gastritis, Crohn's, indigestion. So what caused that? Actually, malabsorption. When they have malabsorption, they cannot actually absorb the vitamin C from the food source. So although they are taking good food source of vitamin C, but they are not absorbing it well because they have the malabsorption issues. Okay. So another one is pregnancy. So for a pregnant lady, she will require higher level due to the pregnancy state itself, because in pregnancy, you know, the mother need to grow, even the fetus need to grow. So the growing require higher vitamin C. After this, in next slides, I will explain how vitamin C works, so you'll understand further why does the growing fetus need vitamin C. Okay. So who else are prone to vitamin C deficiency? Older people. So in older people, they will produce less collagen. Okay, so as we age, the collagen production will be reduced. So we require higher vitamin C level to boost the collagen production for cell growth and repair. So in my next slide, I will explain how does vitamin C works in production of collagen. So as we age, we will lose the collagen production. So vitamin C can boost up the collagen production. That's why older people will tend to have vitamin C deficiency. And then overtraining with exercise. If we exercise and we overtrain, actually when we exercise, we do have some sort of cell injury. So that injury need to be recovered. So that the cells needs to repair itself. So for the repairing of the cells, we require vitamin C due to the collagen production as well. Okay, so more vitamin C will be needed for body's cellular repair for faster recovery in people who overtrain with exercise. Okay, now I go into how does vitamin C works. Okay, first, it is a powerful antioxidant. So a lot of people, they know antioxidant. We have heard many times antioxidant, and they relate antioxidant with free radicals. So what is actually antioxidant and what is free radicals? So I explain this. So we need antioxidant to fight free radicals. This is what we all know. So what is free radicals? Okay, free radicals is actually an unstable molecule of oxygen in our body. So let's say this is a molecule of oxygen. it has one atom and one nucleus circulating the atom. So this is very stable. Oxygen is our friend. We need to inhale the oxygen and we need to survive with oxygen. But once oxygen enters our body, it actually will lose one of its electron due to the inflammation inside our body. So when we lose this electron, the molecule will become unstable. So that unstable molecule, it'll go berserk. It might go just hit all the surrounding cells. So that causes oxidation. So that is what free radical does. It causes oxidation. So the oxidation will cause inflammation, and inflammation will create diseases. So we don't want oxidation. Okay, so that's why to help with that, we need antioxidant, meaning we need anti-oxidation. So what is antioxidant? So one of the antioxidant is vitamin C. So vitamin C is an antioxidant. It will actually donate the one electrons that has been loose. So the electron will make the free radical stable, so we can reduce the inflammation and we can prevent and treat illnesses. Okay, that's why it's very important. Okay, here we can treat the diseases. Okay, another function of vitamin C it will boost up our immunity. So how does vitamin C boost up our immunity? One is by enhancing antibodies. We know that if we have good immunity, we have a good amount of antibodies. So these antibodies actually fight microbes. It fight germs that enters our body. So when we have antibodies, good amount of antibodies, our immunity will be better. So vitamin C, it boosts the antibodies production. So what else does vitamin C does? Okay, immunity is closely related to white blood cells. So if certain people, they have infection, they have fever, they go to a clinic, they see doctor, and then the doctor will take blood. So what does the doctor want to see? Okay, the blood usually is the full blood count, where we want to actually see the white blood cells inside the blood. Okay, so one of the white blood cells we call neutrophil. So what does this neutrophil do? Neutrophil, if we have bacterial infection, so the neutrophil actually will eat up the germs. Okay, the white blood cells called neutrophil will eat up the germs, just like how Pac-Man will eat up the ghost. Okay, so like Pac-Man, they will be looking for the ghost and they will be faster and eating the ghost. So that's how neutrophil is. They will go and find for the bacteria, for the germs, and they go eat the germs. So what does vitamin C do? Vitamin C, it will increase the motility of the neutrophil, meaning it will speeds up the motility of the neutrophil, so the neutrophil can eat faster, so we will heal faster from the infection. So that is what vitamin C do. Okay, so another thing is interferon. So what is this interferon? Okay, vitamin C promotes production of interferons. So what does interferon do? Interferon, just like its name, it will actually interfere with foreign body. So let's say a virus entered our body, okay, or even cancer cell. So they will replicate. Cancer cell will replicate. The virus will replicate. So if we have good amount of interferon will notify the immune killer cells. So these immune killer cells will go and kill the bad people and its surrounding cells. Okay, so interferons will interfere with the replication of the virus, with the replication of the cancer cells. So that is what interferons do. So this is how vitamin C works. It will enhance the production of interferons. Okay, this is with the immunity. So however, if we have infection, we will require more vitamin C. But if we have low level of vitamin C, we will prone to have more infection. So it's like a vicious cycle. So people with poor immunity, usually we tend to need more vitamin C than other people. Okay, so in regards to antioxidant and immunity, so since I said that to build immunity, for people who have low immunity, we require more antioxidant because we require more vitamin C, right? So to boost immunity, we need to take a lot of vitamin C. But as you already know just now, vitamin C is an antioxidant. So it will tackle free radicals by giving its electron. So if they give their own electron, and we take vitamin C high doses at one go, actually it may become pro-oxidant. So we are taking antioxidant to tackle oxidation. But vitamin C in high doses, they lose their own electron, they become pro-oxidant. So they will cause the oxidation and they will cause inflammation. So we don't want that. So that's why we want, so how to tackle this issue? We want an antioxidant actually works in a network. So what we want to do is we want to take vitamin C along with other type of vitamins, okay? Maybe multivitamins, vitamin E, vitamin D, CoQ10. So if we take along with other vitamins, we can tackle this issue whether vitamin C becomes pro-oxidant, okay? Yeah, it works in a network like this. So number 3, how does vitamin C works? Okay, vitamin C helps in collagen production. Okay, so vitamin C actually it's an absolute essential for collagen synthesis. So because it is a catalyst for certain types of enzyme to make the collagen more stable. So we know that collagen, involved in skin, right? So if skin like this, we require vitamin C as a catalyst to produce collagen on the skin. So collagen is everywhere. Our body is actually made out of collagen. Okay, so we require collagen. So if we have low level of vitamin C, the collagen production will be impaired. So we will have problems. We will have problems with our joints. We will have problem with skin. Then we'll have problems with our hair. We also will have problems with oral mucosa, our mouth, because we don't have good production of collagen. But if we have good production of collagen, although we are, getting older, we might be looking like her. I think she's about maybe 60, but she looks really youthful. So because when we take care of our inside, so we can prevent premature aging. Okay. The fourth one, how does vitamin C works? Okay, now I am going into the cardiovascular health. Cardiovascular meaning the heart health. Okay, so for the heart health, so this is the heart. So heart attack usually occur in relation to structural weaknesses within the blood vessel of the heart. So like I mentioned in my earlier slides, animals, they do produce vitamin C, but humans doesn't produce vitamin C, so that will cause the heart issues, okay? So the structural of the vessel, so like this is the heart, so this is a vessel coming out from the heart, so this is a vessel. So the inner lining of the vessel is actually what we call as endothelial cells that is made from collagen too. Okay, the innermost lining, it is made out of collagen. So if our collagen production is good, so the vessel will be very flexible. Okay, it won't be rigid, so it'll be flexible, it can contract, it can dilate. So we call it as vasoconstriction and vasodilatation. So when it contracts and it dilates, we don't have any problem with blood pressure. But if our collagen production is not good, so the vascular smooth muscle is rigid, so that is when it starts to become rigid, we tend to have hypertension, high blood pressure, because our heart need to pump more, so we have hypertension because of the rigidity of the blood vessel. So that's why we want good production of collagen by having good amount of vitamin C inside our body, okay? So another issue is if the endothelial layer is not good, the production of collagen is not stable enough, it can cause breakage, okay? As you can see here, if there is breakage inside the inner lining, our other cells will come to actually form a band-aid. We will band-aid this area by, they will call cholesterol, they call calcium. So cholesterol is actually not a villain. When we see cholesterol inside our body, it is showing us that we have problems inside our body that we need to correct. So the cholesterol is there because other things are present that need to be corrected. So when there is breakage, cholesterol will be produced to come and cause band-aid here, causing band-aid here. So what happens? The blood flows. So when the blood flows, one of the blood cells is platelet. So this is a good flow. But if there is the plaque from the cholesterol, so it can cause blood clot, thrombus here, that will cause heart attack. So this is the heart health, where it is closely related to vitamin C because of one is the rigidity of the vessel causing hypertension, and then another thing is the breakage of the inner lining of the vessel causing blood clot and cause heart attack. Okay. So next will be, okay, vitamin C is actually a complex form naturally. Okay, vitamin C, it consists of a few components. Vitamin C complex consists of few components. So this is the components of vitamin C. So we all know that vitamin C is ascorbic acid. So people know ascorbic acid, they buy ascorbic acid type of vitamin C. But actually, if it's from nature, vitamin C comes in a complex. So ascorbic acid is just the outer layer of the vitamin C complex to protect the inner vital component which is more important. So there is vitamin P, there is vitamin J, there is copper and vitamin K. So vitamin P maybe stands for permeability. So vitamin P is the bioflavonoid component. Bioflavonoid, it produces the connective tissue, the collagen, as well as it will help in absorbing the vitamin C inside our body. So vitamin J, it helps in the oxygenation in our lungs, and vitamin K, a lot of people know vitamin K is to clot the blood. So if you don't have enough vitamin K, we tend to have blood issue, the bleeding issues. Okay, copper, the copper component for the vitamin C is actually in a thyroxinase enzyme form, where it helps the adrenal gland produce noradrenaline, so we won't feel tired. So this is very important for our energy too. Okay, so each of these component, their own function within our body cell, they have their own function with our body cells. So that's why if we see vitamin C deficiency symptom, it is all related to all these components. So what we want is the vitamin C from natural form. So we don't want vitamin C from synthetic type. Okay, the synthetic type where the human manufactured, chemically produced, we don't want that. We want it from the nature. Okay. Okay, so synthetic vitamin C, usually they will be only ascorbic acid component, and that is also actually produced by combining cornstarch with sulfuric acid. So that's why we don't want synthetic type, we want the natural type. Okay. Okay, so we want the natural type of vitamin C. So when we want to take a supplement, let's say certain people, they need to take supplement, vitamin C supplement. So we want the supplement need to be sourced from food loaded with vitamin C complex. So if you want to buy, we need to check the label on the vitamin C itself. So it has to mention where's the food source, the vitamin C they get from. Okay. Okay, so supplement, they should have the bioflavonoid components, and it is better also if they are making it in a capsule form. Usually what they do is they will buffer it. Okay, it will be time release to ensure good vitamin C levels at all time, because as you know by now, vitamin C in high doses, it won't retain, it will be excreted out through urine. So we waste our money, so we don't want that. And then it will also act as a pro-oxidant if we take it at one go. So we want low level but continuously. That's why in capsule form they will put buffered and time release to ensure that component. Okay. Okay, now I go in what are the symptoms of vitamin C deficiency. Okay, number one, the symptoms that caused by fragility of blood vessels. So as you all understand by now, our blood vessel will be fragile if you don't have enough vitamin C because of the production of collagen. So it will be fragile. Another component in vitamin C is vitamin K. So if we don't have the vitamin K component, we will easily bleed as well. Okay. So if we have vitamin C deficiency, what we have is easy gum bleed. So if we brush our teeth, we can bleed, very easily. So it's not supposed to be like that. And then epistaxis, meaning nosebleed when we are exposed to hot water or when we have fever. So we bleed through our nose. So this is not normal as well. Okay, and then easily bruise with no obvious injury. We will bruise like this, but we don't remember that we have any injury. This might be a sign of vitamin C deficiency too. Okay, and then corkscrew hair. which is a pinpoint bleeding around the hair follicles. Doctors call it as perifollicular hemorrhage. So it is, at the root of the hair, there will be marks of reddish area. So that is a corkscrew hair we can see in our body. And then the last will be scorbutic tongue. This is actually a subclinical scurvy because if we found our tongue like this, it is actually major deficit of vitamin C, okay? So combination of glossitis, which is a red shiny tongue, and blotches at the side, tiny microhemorrhages at the side. Okay, this is the symptoms of vitamin deficiency caused by fragility of blood vessels. So what are the other symptoms? Poor wound healing. Okay, poor wound healing are actually due to the slow collagen production because of vitamin C deficiency. So you can see there is a big wound here. So a lot of diabetes patients, doctors see a lot of diabetes patients with this kind of wound. So by now you guys should understand that if we have sugar, high level of sugar, when we are diabetes, we tend to have this wound. And it really, sometimes it cannot recover, it cannot heal because of one of the component of vitamin C deficiency, okay? Skin-related condition, we might have dry, rough and scaly skin. So people with eczema and psoriasis, we cannot have dry skin. But if you have vitamin C deficient, it will worsen the condition of eczema and also psoriasis. And then wrinkled and saggy skin. So if we have low vitamin C, the production of collagen will be lower. We will tend to look older than our age because of the wrinkled and saggy skin. So what we are having is actually premature aging. So just like this lady, she might be 30 years old, but look how she looks. She looks like maybe 50 years old because of the premature aging. So what does, okay, if I'm talking about, as we age, when we age, we actually collect more free radicals. So when we have more free radicals inside our body, we need to tackle that free radicals with antioxidant. That is how vitamin C works, one. Another thing is the one that vitamin C will help boosting collagen, okay? Okay, and then skin condition, keratosis pilaris. We also call it as chicken skin appearance. It's just like how we pluck the chicken, the feather of the chicken. There will be bumps on top of the chicken skin. So that is what we can see. Little reddish bumps on skin of the arms, legs and thigh. That also a sign of vitamin C deficiency. Okay, what are the symptoms that we can see is actually weak immunity. Like I said just now, for people with weak immunity, it's a vicious cycle. So they are more susceptible to infection. They have low body immune defense, so they need to boost up their antibody with more antioxidants. Okay, and then reduced vision loss. Okay, certain elderly people will be diagnosed with ARMD, age-related macular degeneration. From the diagnosis itself, we can see it's a degeneration. Degeneration meaning the production of collagen also reduced, and it's age-related. Why is it age-related? So there must be some deficiency inside our body causing us to have this problem. So we want to correct that. That's why certain supplements where they promote eyesight, for the eyesight, they put that high in blueberries because blueberries is one source for high vitamin C. Okay. And then fatigue and lethargy. Okay, just now I already mentioned the copper part in the vitamin C component. The copper part is actually closely related to the adrenal gland. So this adrenal gland are on top of the kidney. So this adrenal gland play a major role to keep us feel energetic. So if we have low level of the component copper for vitamin C complex, we will have adrenal burnout. When we have adrenal burnout, we will always constantly feel like this. So we don't want that too. Okay, and then weak and easily tired. We can have iron deficiency anemia as well because vitamin C enhance iron absorption. So if we are taking iron, we are taking food high in iron, but we are not taking vitamin C, it might not be absorbed well. So we tend to have iron deficiency anemia as well. Vitamin C, okay. Number 8 will be losing tooth. This will be major deficit of vitamin C, and also hair loss, extreme hair fall due to connective tissue, collagen production as well. Okay, so we'll have this type of problem. So we will lose the hair so much, so extreme hair fall. it might be due to vitamin C deficiency. Okay, now I go into the source of vitamin C. So, as I said, we want natural source of vitamin C. So, there are a lot of natural source of vitamin C from the plant kingdom, but they are sensitive to heat. So, we don't want to heat it up, and we want as much as possible to take it raw, okay? So, okay, the citrus fruit like lemon, oranges, lime, they have a lot of vitamin C inside the fruit, but we have to take it in a whole form, meaning because this area, the spongy white layer, which is the pith, is high in pectin. So that is where the bioflavonoid are coming from. The vitamin P, which is making the vitamin C easily absorbed by our body, is from the bioflavonoid. So it's the white part of the citrus. Okay, and leafy greens. So leafy greens such as kale, Brussels sprout, broccoli, even cabbage. Cabbage are very high in vitamin C. Okay, cabbage is actually, if we cut it and we put it in a 1 cup of the cake cup, right? It contains about 30 milligram of vitamin C. So this veggie contains high content of vitamin C. And then bell peppers. Bell peppers, 1 pepper contain 90 milligram of vitamin C. So our recommended dietary allowance for vitamin C to prevent deficiency is actually 90 milligram. So by taking just 1 bell pepper, we already complete what we need to do. So berries, like I said just now, blueberries, raspberries, they're high in vitamin C as well as low in sugar. So if we have sugar issues, we want this type of fruits because it doesn't have high sugar. Okay, acerola cherry also loaded with vitamin C. Acerola cherry has high vitamin C. The problem is just that we cannot find it here. The natural source of acerola cherry, we cannot find it here. So we might want to consider maybe in a supplement form for the acerola cherry, okay? So sauerkraut. Sauerkraut is actually a cabbage but fermented. So when the cabbage fermented, it becomes 700 milligram of vitamin C per cup. So 1 cup of sauerkraut, it has 700 milligram of vitamin C. Because of the fermentation process, they usually sell sauerkraut inside a glass jar like this. Okay. The plus point for the sauerkraut is that it contains probiotic. So probiotic also a good germs that helps promote our health as well. Okay, other fruits which high in vitamin C, example like papaya, kiwi, mangoes. The issue with other fruits is they have high sugar also. So you want to take it in moderation. And for people who have diabetes and high sugar issues, we might want to take other source of vitamin C. We don't want to take the high sugar source of vitamin C. Okay, natural source also we can get from animal. If we are keen to take it, they present in the organs of the animal. Okay. Okay, where other vitamin source we can find? Actually from supplementation, because certain group of people, we might need more, okay? Like I mentioned just now, there's a group of people who have vitamin C deficiency issues, so we might want to supplement them. So, if we take supplements, we want it natural source and not synthetic. Like I said just now, synthetic only have ascorbic acid content, which is made by cornstarch and sulfuric acid, so it's not good. Okay, we want it from natural source. So what we need to do is we need to read the labels. So the food source of the vitamin C, the bioflavonoid component, usually they will mention. And if it's in a capsule form, usually it will be buffered type, slow and time release. So we don't want high doses at one go. Okay, high doses at once will be excreted out of the body. That is one. Another thing is high doses without its other complex. Vitamin C comes with other components. So if we have high dose of ascorbic acid but low of other components, we can have the other issues. Like adrenal burnout, we still can develop if we take high ascorbic acid, the synthetic type. Okay, so vitamin C. Okay, even in 1932, the gentleman who found out about vitamin C, he did a study with scurvy. So he found out about vitamin C. What he said, you can't cure scurvy with isolated ascorbic acid. So since 1932, he already mentioned that we cannot take ascorbic acid alone. We need to take its whole component. So what to do if we have vitamin C deficiency? One is we need to consume vitamin C. So from food containing high vitamin C content. So maybe just like this baby, he's eating the lemon. So cute, right? So certain people, they might not tolerate this. So they want to take vitamin C supplement. It must be with the mentioned criteria. Okay, another thing that we need to do if we have vitamin C deficiency is we need to cut off the sugar from our diet. Okay, sugar is very important to be cut off from our diet because, like I mentioned just now, sugar molecule fight for the same place as vitamin C. So if we have high sugar and we are taking vitamin C, our body will choose sugar and it will be excreted, the vitamin C will be excreted out. So it won't be uptake by the body cells. So people with high level of sugar, like diabetes patients, they also need to burn off the excess sugar, not just cut sugar from diet, but they need to burn off the excess sugar so that the vitamin C can be able to be used by the cells. Okay, how do we burn off the excess sugar? What we can do is exercise, and also we can do fasting. Okay, next will be for drinkers and smokers. Okay, I've explained just now, in alcohol there is high sugar also. For smokers, there is a lot of toxin causing free radicals. So the solution is only one, is to quit. So when they quit cigarettes, when they quit alcohol, they will see tremendous effect with their health 10 to 20 years down the line. Okay. So next, okay, this is just extra sharing from me for whoever interested in purchasing supplements. What they need to do is actually they need to find vitamin C supplement from whole food concentrate. So I give here some example. So this is a children's vitamin C. Okay, they put there here sugar free, and then as you can see, it is a whole food concentrate. So the vitamin C is coming from whole food concentrate. Okay, like this, right? So people know vitamin C, ascorbic acid. So they need to mention the ascorbic acid part. And then, but they also do mention the C source. Where do they get the vitamin C source from? So they put here grape seed, and then bilberry, and also concentrates of mango, papaya, guava, pineapple. This is for children. So for children, a lot of children, they don't have sugar issues actually. But when we concentrate it, the sugar won't be that high. So they are only taking the vitamin C component from the source. And then they also have the bioflavonoid complex. Here the bioflavonoid complex from citrus lemon, meaning from the pectin, which is high in bioflavonoid. Okay, this is chewable. Just now was for children, so it's chewable. So for adult, usually we'll take in a capsule form, right? So if capsule, we want it to be buffered. Buffered also same meaning with time or slow release. Why? Like I've mentioned just now, because we don't want high doses at one go, and as well as we don't want it to be pro-oxidant. So if it's buffered, the capsule will be coated so that it will be released slowly per hour, maybe just 100 milligram per hour, so it won't be pro-oxidant. So like this, they put here buffered and time release. So usually if it's in a capsule form, they will put here fast acting because it has vitamin C complex. It easily absorbed due to bioflavonoid component, and it is long acting. It is long acting because of the buffered type. It's slowly released. So over the course of 24 hours, they will maintain with example 100 milligram per hour. So we want that type, time release, buffered, as well as bioflavonoid component. Okay, so this is the back of the example of the supplement where we can see the source of vitamin C. See, they put here acerola cherry. So they put also bioflavonoid complex from lemon, and they put here citrus pectin. Citrus pectin is actually also the bioflavonoid component. So we want to read the label. So we want to find all these things on the label. Okay, then another sharing is the epigenetic testing that we do in our wellness site actually. So epigenetic test is a lifestyle influence on our genes. DNA test is genetic test. We cannot change our DNA, but our DNA is actually, it's like a lock. We can open it we can turn it on, we can turn it off. So epigenetic test is actually our lifestyle influence on our genes. So this test, we look at vitamin indicators. So in this section, we will see which vitamin is low inside the body. So the deficiency that we see is at cellular level, not blood. So it is not an investigation tool, it's just a tool to detect what we miss at cellular level. Okay, so like this, after this I will make it bigger. Okay, so if we don't correct the cells deficit, future health will be affected. Just like I mentioned just now, if we have vitamin C deficiency, 10 to 20 years down the line, we might have a heart problem. Okay, so I'll make it bigger here. Okay, as you can see here, vitamin C deficiency, right? Okay, there is vitamin C deficiency at cellular level. So it won't be picked up if we do blood tests. Okay, this is an epigenetic testing. It's a lifestyle. Due to our lifestyle, we have vitamin C deficiency. So this person able to detect the vitamin C deficiency, so the person able to correct the internal issues from the cells itself. So cells will form organs. Organs will become systems, and systems will become human body. So if you don't correct at the cellular level, we will have issues with our health 10 to 20 years down the line. Okay, so for this person, once he corrected, he will have his health and wellness becomes okay lah, alright? Okay, last conclusion. So to keep our body fit, energetic, youthful, not age prematurely with health problems, we need to really observe what we eat, because the disease is not meant to be for us. It is us who choose it, okay? So we need to eat something like this. Alright, so food coming from good, healthy source are our primary choice. With that, we can prevent many illnesses, including vitamin C deficiency related. Okay, this is just a little bit sharing of on our side. This is where we are located. It's actually in Sepang, near KLIA. So this is us lah, Leiya Wellness in Sepang. So you can also find us in our website, leiyawellness.com.my. Okay. So that's about it. So thank you.